Hey everybody, Dr. Brian Hovers here. Welcome to the Spine Nerd Podcast. Today is going to be a little different than you have gotten used to hearing from the podcast. We have mostly focused on science that pertains to pain medicine and trying to help everybody learn a little bit more about how we treat patients. But over the past month, I've had to face something very unexpected. And it has really shifted the way that I've been thinking about what I want to do with this podcast. So, over the past month, I've been diagnosed with squamous cell carcinoma of the oral cavity. So, I had a lesion on my tongue and about a week ago, I underwent surgery to have the lesion removed, and I had a dissection of my neck for the lymph nodes to be removed. And so, if you're watching on YouTube, you can see the lesion on the right side, or the incision that's healing well on the right side of my neck. And I just, one, want to tell everybody I'm doing well. We're recovering well. Lymph nodes were clear. Everything is going well. And I am just very, very lucky to be in the position that I am. My wife is a dentist. She spotted the lesion early. We were able to get connected with some amazing ENT physicians that were able to help me with not just my biopsies for my tongue, but also getting me in for surgery in a quick manner and getting to it while it was still early enough that I'm not going to hopefully need much more treatment beyond surgery. But this experience has reminded me of something I've known for years, but sometimes it gets pushed aside in the busyness of life and of medicine and of us trying to care for patients. Health and wellness are not optional, right? They are the foundation of everything that we do. As I said earlier, we've really focused on pain medicine, on the things that we can do to help patients through these different diagnoses that they have. And yes, we've talked a little bit more in some of the episodes about the ancillary things that we can do, the additional things, the biopsychosocial aspects, the different things that are not procedural aspects of chronic pain. Uh, But I don't know that that's enough, right? Chronic pain doesn't live in isolation, just like, recovering from cancer or making your way through any diagnosis or surgery or life is. Life in health is connected to lifestyle, to nutrition, to movement, to sleep, to stress, and to preventative care, right? Making sure that a part of all of those aspects is getting in for normal routine visits, getting your screenings as appropriate to be able to find the unexpected, right? Most people would not expect 42-year-old with no risk factors, no history of smoking, no chewing tobacco, no excessive alcohol intake to be at risk of oral cancer. But with talking to the ENT docs that I have had the pleasure of working with, it's very common now that they're seeing patients in their 20s, 30s, 40s with no risk factors presenting with squamous cell cancers of the oral cavity. And so getting in for regular screenings, to your dentist, and obviously this goes for, for women, for pap smears, for mammograms, for all of us for colonoscopies, being able to find these issues as early as possible is a part of wellness. And so going forward, obviously, I still am a pain medicine physician. I still care deeply about what we do for patients, but I want to be able to be a little bit more, I don't know if holistic is the right word, but well-rounded in terms of all of the things that we're going to be discussing. Because, as I said, pain medicine doesn't work in isolation, right? Us doing amazing procedures, and yes, we have some amazing procedures that we can do for patients. But if a patient only has a spinal cord stimulator or gets a basic vertebral nerve ablation, that in isolation is not going to help them to restore function and live the life that they want to live. And so, you know, I want to take a step back to the me that I was before, going through residency and fellowship, right? The me that was a personal trainer for a long time. The me that developed my medical school's wellness program and wrote nutrition plans and exercise plans for a lot of the other medical students, and trying to find a way to incorporate more of these, wellness type of techniques into how we think about pain medicine and how we think about treating patients in general, and honestly, how we think about treating ourselves. Because I think a lot of this stuff, though we are healthcare providers and though we are constantly working on trying to help other people, many of these things kind of correlate to us as well. I think as I've kind of gone through this past week of, recovering from surgery and walking through, a lot of the things that I talk to patients about in terms of the different techniques for helping with pain have been useful, right? Early on, I had a lot of swelling in my mouth, and one of the things that I use a lot of was ice, because obviously ice can really help with acute inflammation. And I was using a lot of techniques such as, distraction and mindfulness and trying to, be around other people in social situations, because in social situations we deal differently with pain. And pain but is there, and but it isn't always as distressful, right? And so I had the opportunity to really work through that and acknowledge the pain, right? It was there. Like I have this large incision on my neck. There was pain there, but understanding also that the pain's there for a reason, right? Right. At that point, my body was trying to heal and my body was trying to recover from having had a surgery that is life-saving for me. And so I want to make sure that we are using all of those techniques and discussing them better and working on ways to make sure that we're all knowledgeable in how to walk through this, both for our patients and for ourselves. And so, how do we bridge pain medicine and wellness? I think, that's something that many of us inherently understand, but I think we can go much deeper, right? Obviously we know that pain is never just physical. Pain is our body's response, but it's also an emotional response to what's happening in our body. And so there are many factors that are deeply intertwined. We know about a lot about sleep and stress and how they can amplify or reduce pain perception. We know about movement and exercise, how it can, protect our joints and be able to build muscles that de-emphasize the stress off of, ailing joints or discs, right? We have briefly touched on nutrition, I think one episode, and that's my fault, right? 125 episodes. I think we've done one on nutrition. And I have a master's degree where I did my thesis in nutrition. And so I think we can talk a little bit more about nutrition and how that can affect inflammation, healing, recovery. I think that's a really interesting topic for me, because as I've been walking through this past week, I've been really thinking a lot about nutrition and what that's going to mean for me going forward. Um, when I wrote my master's thesis in 2005, one of the books that was very impactful for in terms of my understanding of nutrition was the China study. And it was a study that showed that patients who had cancer um, did better with essentially a vegan diet. And revisiting that 20 years later and looking at some updated information and studies, that's not what my brain has decided on using for myself moving forward. And I think being able to walk through how, how I made that decision for myself, but also B, how that plays into our greater understanding of wellness on the individual level as well as wellness for our patients, I think is, a really, really interesting way that we can try to understand how to help ourselves and our patients better. And like I said, I mean, I think there are a lot of practical ways that we can kind of help give guidance, right? As much as we want to give all of our patients all of the information all up front, it can be a lot. It can be overwhelming to the patient, and it can be overwhelming for the amount of time that we have to be able to discuss with them. And so I think hopefully one of the ways that we can kind of go through this is making a resource that you can direct patients towards to be able to show them different ways of movement where 5 or 10 minutes daily can really change your function, your mood, how we can focus on sleep and what sleep can do to be able to help us both emotionally and physically, right? How obviously we've talked about nutrition, how we can work on stress techniques and breathing techniques. One of the things that I have done in my career, which I have found over or have paid more attention to over the years, but I try to teach my patients breathing techniques. Specifically, when we're doing procedures, I do many of my procedures without with only local sedation. And so I teach my patients breathing techniques beforehand and while we're going through the procedure, working on deep breathing and slow controlled exhales, right? And those types of things, activating the parasympathetic system, that can become tools that can be helpful for the long haul, right? And so, obviously I think I already brought up how now I, am much more of a believer, not that I ever wasn't, but understand the crucial role of screening and prevention in terms of being able to find things early because just because there are risk factors that make things more or less likely doesn't mean that the unexpected can't happen to anybody. And so, if we're thinking about wellness and longevity, a lot of those ways that we want to be able to live our best life, we have to make sure that we are catching and identifying any issues as early as possible and being able to treat them and rectify them as best we can. And so, just I want to thank you all for listening, for hearing my story, for understanding where my head is transitioning to, and just I want to reemphasize this is not a pivot away from pain medicine, but an expansion of what we've done. I think honestly, if we're being truthful, like we only have a finite number of tools in pain medicine. I think one of the reasons why episodes have been kind of fewer and farther between over the past year or so is because once you've kind of covered those diagnoses and really dug into them, there's only a certain number of studies that are really changing practice that come out. And so this is really just an expansion of what we've been talking about and just looking at more opportunities to be able to impact what the lives of our patients, the lives of those around us, and obviously helping ourselves as well. Pain and wellness are inseparable. And if we can help people to move better, we can help people to feel better, live better lives for longer periods. And so, once again, thank you for giving me the opportunity to tell you my story, to hear the things that we have been learning together. And I'm really hopeful that this kind of expansion of the podcast into some different realms is going to be both interesting, entertaining, and educational for all of you. So thank you guys again. Once again, Brian Hovis, Spine and Nerve Podcast, and we will chat soon.